Please subscribe to my channel and do hit the bell icon. Hello to all dear students. Our today's topic of discussion is extracorporeal removal of drugs. Extracorporeal means it is a supportive treatment for removal of waste metabolites outside the body. Means as such we have got various route of excretion of drugs, such as renal route being the major one, and we have got biliary route also. See, whatever water soluble drugs are there, these drugs are mainly eliminated out of our body via the renal route. But in case of kidney damage, or you say when the patient is with end stage renal disease, and even those who have become intoxicated with a drug as a result of drug overdose, they require a supportive treatment to remove the accumulated drug and its metabolites. As such, several methods are available for extracorporeal removal of drugs, such as dialysis, hemoperfusion, and hemofiltration. The main objective of these methods is to rapidly remove the undesirable drugs and metabolites from the body without disturbing the fluid and electrolyte balance in the patient. So we'll discuss all these three types of extracorporeal removal of drug one by one. So first, starting with dialysis. Dialysis is an artificial process in which the accumulation of drugs or waste metabolites is removed by diffusion from the body into the dialysis fluid. The principle underlying dialysis process is that as the uremic blood or fluid is equilibrated with the dialysis fluid across a dialysis membrane, waste metabolites from the patient's blood or fluid diffuse into the dialysis fluid and are removed. So this is the principle. So suppose this is a patient, and the blood from the patient's body, we are trying to equilibrate this patient's blood with a fluid, and the name of this fluid is the dialysis fluid, across a dialysis membrane. So waste metabolite from the patient's blood is been diffused into the dialysis fluid. Okay, so diffusion is done. Diffusion means movement of the substance from an area of higher concentration to an area of lower concentration. So here blood has got large amount of waste metabolite. So these waste metabolites is been moved. It is being moved from an area of higher concentration to an area of lower concentration. So this is diffusion, and this is the main principle behind this. Next, every time this dialysis fluid, it has been removed, and every time it is been replaced by a fresh dialysis fluid, so that every time the concentration of the dialysis fluid is maintained at a lower concentration. This dialysis fluid, it is also known as dialysate. So this dialysate mainly contains water, dextrose, electrolytes like potassium, sodium, chloride, bicarbonate, acetate, calcium, etc., and other elements similar to normal body fluids without toxins. This dialysis are of two types. First one is peritoneal dialysis, and secondly hemodialysis. So we'll check out these two one by one. First, starting with the peritoneal dialysis. The peritoneal dialysis uses peritoneal membrane in the abdomen as the filter. The peritoneum contains visceral and parietal components. The peritoneal membrane provides a large natural surface area for diffusion of approximately 1 to 2 meters squares in adults. It is permeable to solutes of molecular weight which is less than or equals to 30,000 Dalton. However, only a small portion of the total splanchnic blood flow, that is 70 ml per minute out of 1200 ml per minute at rest, comes into contact with the peritoneum and gets dialyzed. A catheter, or you say peritoneal catheter, is placed surgically. The dialysis fluid is pumped into the peritoneal cavity where waste metabolites in the body fluid are discharged rapidly. The dialysate is drained and fresh dialysate is reinstilled and then drained periodically. Peritoneal dialysis is also more amenable to self-treatment. However, slower drug clearance rates are obtained with peritoneal dialysis compared to hemodialysis, and thus longer dialysis time is required. Next, continuous ambulatory peritoneal dialysis, abbreviated as CAPD, is the most common form of peritoneal dialysis, and many diabetic patients become uremic as a result of lack of control of the disease. So here, about 2 liters of dialysis fluid is instilled into the peritoneal cavity of the patient through surgically placed resident catheter. The main objective is to remove accumulated urea and other metabolic waste in the body. The catheter is sealed and the patient is able to continue in the ambulatory mode. Every 4 to 6 hours, the fluid is emptied from the peritoneal cavity and replaced with fresh dialysis fluid. This technique uses about 2 liters of dialysis fluid, and it does not require a dialysis machine and can be performed at home also. Next, we'll check out some of the advantages of peritoneal dialysis. No need of anticoagulant treatment. No need of needles or vascular access. Schedule flexibility. Easier to travel. Few risk of dialysis related cramps. Clinic visit limited to 1 to 2 times a month. Steady state therapy. Gentler ultrafiltration. Next, we'll check out certain disadvantages of peritoneal dialysis. Permanent external catheter body image problems. Risk of peritonitis. Risk of weight gain and glucose in dialysate. Must store dialysis equipment and supplies at home. And lastly, need for self-monitoring and care. And so this was all about the peritoneal dialysis, these their advantages and disadvantages. Next, we'll check out about hemodialysis. For hemodialysis, it mainly utilizes a dialysis machine and filters blood through an artificial membrane. So here in this image you can see blood is taken from the patient and this blood is pumped into a dialysis machine. So this dialysis machine contains several tubes. The red color tubes you can see, these are the tubes present in the dialysis machine, and these tubes are mainly made up of semi-permeable membrane, and through these tubes blood passes. Outside the tube, that is what you can see in blue color, that mainly contains fresh dialysis fluid. The waste metabolites from blood moves to the dialysis fluid across the semi-permeable membrane by diffusion. The used dialysate is removed and every time fresh dialysis fluid is pumped into the dialysis machine. After purification, the blood is pumped back into the patient's body. So same thing you can see over here. So from here the blood is taken from the patient's body, and this is, you can say, the dialysis machine. The tube is made up of a semi-permeable membrane. Suppose this is one tube where the blood is passing, and this purple color thing is your dialysis fluid, and this red color is the blood. And every time because of diffusion, the waste metabolite will move from the blood to the dialysis fluid, and this dialysis fluid, the used dialysis fluid, is moved into another container, or it is removed off, and every time a fresh dialysis fluid is being used, so that diffusion takes place, or you can say purification of blood should take place. So this hemodialysis requires access to the blood vessel to allow the blood to flow to the dialysis machine and back to the body. So for permanent access to the blood vessel, an arteriovenous fistula or graft is created by surgical procedure. Here in this image you can see blood vessels. One is red color and another is blue in color. Red color blood vessel means artery and blue color means veins. At a point, vein and artery is joined together to form an AV fistula. What you can see over here. This is AV fistula. And from this fistula point, the blood is taken to the dialysis machine. And after purification, the blood is moved into the veins of the patient. So next we'll have a schematic flow chart kind of presentation for this hemodialysis. Suppose this is a patient and from here the blood is removed, and obviously this is the removal of blood, the impure blood that need to get purification, because kidneys are not working, kidneys are unable to do purification of the blood. So we are removing the blood and we are moving it outside the body. Next, we need to maintain a pressure. So we have got an arterial pressure monitor over here. Next, this is a blood pump, and this blood is pumped into a dialyzer, a dialysis machine. Here also we need to maintain a pressure. Inflow pressure monitor has been there. Next, you can see in this dialyzer what will happen. Impure blood is converted into pure blood. Means you can say purification of blood will takes place because of by diffusion with the help of the semi-permeable membranes available in this dialysis machine. And the red color line you can see, that is for pure blood. And we need to move it inside the patient's body, and before moving it we need to maintain again the pressure. We have got a venous pressure monitor, and one more important thing, that is air trap and air detector, because air should not be moved inside the patient body. We just need to direct blood into the patient's body. And finally, after purification and removal of all the air whatever is there, we need to place or we need to move the purified blood back into the patient's body, and this is your clean blood. So this is how hemodialysis will be taking place. Few more important attachments for this dialysis machine are this thing. This is a saline solution which is added over here, and this is an injection of heparin and heparin pump. Heparin is used to prevent blood clotting during the dialysis period. Two more vessels you can say is been placed. One vessel is for throwing out the used dialysate, and another vessel containing the fresh dialysate or dialysis fluid that we need to replace again and again repeatedly. So this is how hemodialysis will be taking place. Dialysis may require from once every 2 days to 3 times a week, with each treatment period lasting for 2 to 4 hours. The time required for dialysis depends on the amount of residual renal function in the patient, any complicating illness like diabetes mellitus, the size and weight of the patient, including muscle mass, and efficacy of the dialysis process. Dosing of drugs in patients receiving hemodialysis is affected greatly by the frequency and type of dialysis machine used and by the physicochemical and pharmacokinetic properties of the drug. Next, we should check out various factors affecting dialysability of drugs. These are physicochemical and pharmacokinetic properties of the drug. First one is water solubility. Insoluble or fat-soluble drugs are not dialyzed. For example, glutathione, which is very water insoluble. So, water insoluble drugs we should not prefer for dialysis, but water soluble drug, it can be easily undergo dialysis. Next, protein binding. Tightly bound drugs are not dialyzed because dialysis is passive process of diffusion. For example, propranolol is 94% bound. So therefore propranolol, it is very much difficult to undergo dialysis. Okay. So protein binding, any drug that have got a very good protein binding, the dialysis will be failing for such drugs. Molecular weight. Only molecules with molecular weight of less than 500 are easily dialyzed. For example, vancomycin is poorly dialyzed and has a molecular weight of 1800. Drugs with large volumes of distribution. Drugs widely distributed are dialyzed more slowly because the rate limiting factor is the volume of blood entering the machine. For example, for digoxin, the volume of distribution is 250 to 300 liters. Drugs concentrated in the tissues are usually difficult to remove by dialysis. Okay, so if drug is present in the blood, it can be easily dialyzed. But when drugs are widely distributed into various tissues of our body, in such circumstances, dialysis will be very much difficult. So these were various factors affecting dialysability of drugs. Next, we shall check out certain advantages of hemodialysis. Effective removal of waste metabolites, care given by trained professionals, rapid correction of electrolyte imbalance, no equipment to store at home. Treatment usually occurs only 3 times a week. Next, we will check out the certain disadvantages of hemodialysis. Vascular access surgery required. Use of large needles. Schedule inflexibility. Must travel to center 3 times a week. Cramping with ultrafiltration, and lastly, risk of bacteremia with tunnel catheter. So this was all about hemodialysis and peritoneal dialysis. Next, we'll check out another method of extracorporeal removal of drug, and that is hemoperfusion. Hemoperfusion is the process of removing drug by passing the blood from patient through an adsorbent material and back to the patient. So here any semi-permeable membrane is not used, but an adsorbent material will be used and the impurity will get adsorbed. So adsorbent material will be used, and because the drug molecules in the blood are in direct contact with the adsorbent material, any molecule that has great affinity for the adsorbent material will be removed. So from the patient, the blood is taken out and via the roller pin, maintaining a pressure gauge, and it is moved into the hemoperfusion machine, that is your hemoperfusion cartridge, and here the adsorbent material will be present and it will absorb all the impurities. So after this, the blood will get purified. Again, a pressure is been maintained, plus a bubble trapper is also important, and lastly, the purified blood will be moved into the patient's body. Now here, if we try to zoom this hemoperfusion cartridge, we will find something like this. From the patient blood, along with the blood components, impurities will be there. Suppose this red color ball is the blood component and yellow and green color balls are impurities, and these impurities will get adsorbed on this material. The purified blood will be removed out, but the impurities will be present or adsorbed on the hemoperfusion cartridge only. Two main adsorbent used in hemoperfusion includes activated charcoal, which adsorbs both polar and non-polar drugs, and amber light resins. So these are the two important adsorbent material used. Hemoperfusion is a useful procedure for rapid drug removal in accidental poisoning and drug overdose. So this is all about hemoperfusion. Next, we shall check about hemofiltration. This hemofiltration is a process by which fluids, electrolytes and small molecular weight substances are removed from the blood by means of a low pressure flow through hollow artificial fibers or flat parallel membranes. So this is a kind of hemofilter or hemofiltration machine. So here outside, patient's blood is added, and this is a body of the hemofiltrate. If we'll try to see what exactly here is, it will be somewhat like this. So here dialysate is not used. Instead, pressure is applied across this hemofilter and solute are pushed through the membrane along with the plasma and water. So this yellow color thing is your unwanted waste metabolite, and this waste metabolite is being removed from here. This removed volume is termed as ultrafiltrate, and it parallels the physiology involving Bowman's capsule and the glomerular bed. Okay, so a large amount of blood volume is been removed. A large amount of volume has been removed, and below, from here, purified blood, whatever is there, it is added back to the patient's body. But because of this volume removal, a replacement fluid is added back after hemofilter to maintain adequate volume status in the patient. Hemofiltration is a slow, continuous filtration process that removes non-protein bound small molecules less than 10,000 Dalton from the blood by convection mass transport. The clearance of the drug depends on the sieving coefficient and ultrafiltration rates. Hemofiltration provides a creatinine clearance of approximately 10 ml per minute and may have limited use for drugs that are widely distributed in the body, such as aminoglycosides, cephalosporins, and acyclovir. A major problem with this method is the formation of blood clots within the hollow filter fibers. So this is all about hemofiltration, and these were various extracorporeal method of drug removal from the body. So I hope you find this video helpful. Thank you for watching.